I'm Dr. Blanchard with Total Rehab, and today we are going to talk about chronic ankle pain, specifically ankle pain that's related to ankle sprains. So there are three ways to grade an ankle sprain depending upon the severity of the trauma. The first one, grade 1, is just a micro tearing of the ligaments there. Usually people recover pretty well after those, after a week or two, sometimes a little bit longer. Grade 2 is where there's complete tears of some of the fibers of the ligament, but the ligament as a whole still stays intact. And then grade 3 is a complete rupture of the ligament. Those two grades, grades 2 and 3, can lead to chronic conditions. Oftentimes instability is an issue with that. So 90% of all ankle sprains occur in what's called an inverted position. So this is the inverted position when the ankles turn in this direction, and there are two main ligaments that are involved with that. Now, ligaments differ from tendons in that ligaments attach bone to bone, where tendons attach muscle to bone. In grade 2 and 3 ankle sprains, it's likely that you also have some other soft tissue damage in addition to the ligaments. So tendons will have likely been strained as well. Those two grades make you susceptible to future sprains of the ankle as well. The instability occurs because those ligaments and soft tissue no longer provide the support in keeping the motion of the ankle in check. As part of the inflammatory process, your body will lay down scar tissue within the joint that then also restricts other movements. So you kind of get this imbalance of motion at the ankle where you have instability in this inverted position, but then oftentimes you have restrictions in the other motions of the ankle. So this position we see often is limited for those folks who have that chronic pain related to instability. This is called dorsiflexion. So we'll have you bend this knee up. For those who are limited a little bit in that position, you can mobilize what's called the talus here by bringing up into dorsiflexion and then applying a force posteriorly to facilitate that movement into dorsiflexion. You can also play with the amount of rotation working into those restrictions through there. Another direction that folks are often limited in is their ability to extend the foot outward. So let's take this one here and we'll show. Point your toes away from you and curl them down. Good. So oftentimes this can be a direction of limitation. So go ahead and bend this one back up. And the glide that we provide here is we stabilize at the foot, and then we apply a force here posteriorly above the ankle. And again, this facilitates that motion into plantar flexion. Those are some of the manual techniques that we utilize in addition to some others. For those, again, who have instability, it's also important to strengthen the tissues surrounding the ankle. So we're going to show you a few exercises that you can perform at home. So the first exercise for ankle instability is just a single leg stance where you'll stand on a single leg. We'll have Dallas perform this here on the floor. Now you can make this a little bit more difficult by having an unstable surface. We'll have him next do it on the trampoline. I would hold that position for 20 seconds, and you can alternate and repeat each side 5 times. So the next exercise is a dynamic stability exercise that's a little more advanced than previous. It requires a lot of lateral movement. Dallas, demonstrate that. Once you get the rhythm, you can pick up the speed. Okay, this next exercise is also using the ladders, and it's again a dynamic stability exercise that's pretty advanced. Let's demonstrate that. It's important that you're up on the balls of your feet. As you get the rhythm again, it's important to increase the speed. So these are exercises that help with instability of the ankle, specifically the lateral side of the ankle, and can resolve some of those stability issues as well as the pain. So if you're having ankle pain, we can help.